Hi, I'm Kim Sharp, and you're watching Community Checkup, which is a show about all things health. So to prepare us for today's show, we're all going to take a deep breath. You ready? Yes. How was that for you? For some people, that is not an easy thing to do. And that's what we're going to talk about today. We're going to talk about respiratory health issues. And joining me is Cindy Cooper-Smith, who's a registered respiratory therapist with University of Colorado Health. And I have Selena Lujan, who's the Assistant Program Coordinator for Healthy Sustainable Homes here at the City of Fort Collins. Thank you both for being here.
Good to be here. Yeah.
Cindy, let's start with you and have you tell us, what are some of the most common respiratory ailments that people suffer with?
Well, the thing I think of first is asthma, because children can have that affliction as well as adults. And there's chronic obstructive lung disease. That's a kind of a older population usually.
Is that COPD?
That is considered COPD. It's a combination of different ailments within the breathing lung system, and often stimulated by many years of smoking. And there's the emphysema.
How is that different from COPD?
You know, emphysema is just the one piece of a triad that's in the whole COPD picture, but they're very specific to what's going on in the lungs. So they will often put emphysema into COPD. There's pulmonary fibrosis. There's really actually a fair number of things that can go awry in the lungs.
And so who's at risk for these conditions? You'd mentioned people who smoke
oh, yes,
for a long time.
Absolutely. We do know.
Children?
It's detrimental to smoke. So anyone that does a kind of chronic daily addictive behavior that puts particles into our lungs, we know that can cause damage. You know, really, we know asthma is often genetically passed on, but asthma is quite common in the children. So we look at, as far as susceptibility to pulmonary, any kind of pollution problems too, we look at the very young, so children under the age of 18, we look at the elderly, and then we look at people with actually respiratory chronic diseases and heart and diabetes. So people with some of the big chronic issues, that's almost a third of our population in the Larimer County.
So when you said pollution, you're talking about outdoor air quality?
Correct.
Okay. Selena, your program deals with indoor air quality. Why don't you explain to us more about that?
Sure. So the Healthy Sustainable Homes program is a free volunteer-driven program. And so what we do is in-depth home health assessments. And so our master home educators focus on identifying any biological or chemical contaminants in the home, along with any safety hazards. And so it's about a 2-hour assessment, and they go through the home and identify 7 key areas of the home. And it's all of our keep it areas, and this is our document. So we focus on keeping it clean, keeping it free of contaminants, keeping it dry, keeping it mold-free, keeping it well-maintained, pest-free, safe, and well-ventilated.
Are those the 5, or I'm sorry, the 7?
These are the 7, yes. And so all of these areas have a great deal to do with indoor air quality and keeping it as healthy as can be. So once the assessment is finished, we give at least 3 recommendations to making the home a little bit healthier. And now these are low-cost and no-cost solutions because we want to be able to give people something that they can have control over without saying, oh, you have to redo everything in the home. But just really those key areas that they have control of and making it healthier in the home.
Give me an example of what you might recommend that somebody do.
So the simplest thing that has no cost whatsoever is taking off your shoes. You know, we always talk about, think about where you're walking each day and what you're collecting on the bottom of your shoes. And then you're just tracking that into your home, and then that just gets recycled into the air system. And so, easy thing to do. But at the same time, it's the hardest thing for people to do because they get so used to just having their shoes on and, you know, oh man, I have to go back outside and put my shoes back on and that thing. Another big thing is commercial grade walk-off mats. Really simple, put in front of each.
What is that?
So I should have brought it today, but I didn't. It's just kind of it has some, you know, let's see, how would you explain it? It has a rubber backing to it,
Okay.
and then it has this commercial grade. It's kind of little rivets in it.
Oh, okay.
And so you wipe off your feet, it gets all the dirt, all the junk off, and so a lot of things that, the sun can't get rid of it, the sun can't get in the house. So the sun really takes away any pesticides that is outside. But when you track those into the home, the sun's not there to get rid of them.
And how do these things impact someone's respiratory health?
Oh, sure. So our, Healthy Sustainable Homes program is really there to create awareness to reduce any asthma triggers. And those are the biggest ones: dirt, dog hair, cat hair, dander, any pollens, any chemical sprays or anything like that. So those really, anything you step on outside that can cause those asthma triggers that we're really trying to reduce gets them out. And those are really just the simple 1-2 things you can do.
That sounds simple.
Yeah.
Because the city has this program and because you have a job, what are the levels of people, or how many people in Larimer County have issues with respiratory health? Would you estimate?
It's a total estimation. I can tell you that an easy number to remember for asthma alone and worldwide, but especially in the U.S., is about 10% of children and adults.
And would that be in Larimer County too, do you
Absolutely, yes. I know in the state of Colorado, that's about 58,000 children under the age of 18.
Wow.
So it's not a low number.
No, that's not.
And so it's a real issue. Yeah. And keeping triggers at bay for people with asthma is really quite remarkably important.
All right. Well, as you can see, we have a whole table full of toys here, and I'm excited to learn what this stuff is all about. Do you want to go first in your show and tell?
Oh, sure. Well, I do teach an asthma education outpatient program, and the goal of that, of course, is to let people know how to manage their asthma. If we can teach people to manage their asthma, they'll have less emergency room, urgent clinic care, and there's a lot of stuff that goes along with asthma.
Well, show us.
Gadgets. I brought just a few today. But I like to teach people how the lungs work and then what all the gadgets are used for. And the same as your program, keeping it as simple as possible, because none of these, especially children, need to be feeling like victims. They need to feel healthy and well so they can play. Olympic athletes have asthma, but the challenge is making it more just sustainable in your daily living without being victimized. So cleaning up triggers, taking medications that doctors recommend, taking them correctly, listening to our breathing. If there was one message I would give to the people listening today, is if you think you have asthma or have that diagnosis and you have symptoms more than twice a week, or actually wake up in the morning or during the night with some symptoms. Symptoms being
I was just
coughing,
going to say, what are those symptoms?
Wheezing, tightness, a little shortness of breath. That's actually a little cue to you as a person to say, oh, my asthma's maybe not in great control. And that's our message to people with asthma. Stay in great control. So a visit to the doctor is appropriate. And they might need to do a balance with your medicines and give you an evaluation. But everyone should breathe perfectly.
What things on this table help people keep their asthma under control?
Well, almost everything. These are just little demonstrators, but a lot of people do take, and you may have seen these out in the public. It's just a simple medication mixed into a canister, and when deployed, it's this little mist. This mist needs to be breathed in deeply into the lungs where it deposits to help, and just puts it right in the little airways of the lung so the medicine can help exactly where the issue is. A peak flow meter, I prefer, this can be used along with symptom tracking, and this will measure how much you blow out in 1 second. And it gives you a flow rate on a little disc.
All right.
So I take a deep breath, and I burst out. I hope you can see that the dial went up. And I have these set a little wrong. I got about 475. That's my normal. Is that good? That's not bad for me.
Okay.
Everyone has their own personal best number. So that's part of the training that goes along, and that's by your age and your height and how big your lungs are.
Okay.
So that's a peak flow meter.
What else do you have to show?
Oh, I got a little chamber. Now we will recommend, we know delivery of medication, often these little inhalers, is beneficial if you use a little chamber.
Okay.
And basically you're just putting that device into a holding chamber, and when I spray the medicine, it holds it for a second, so it's about timing. Coordinating all the different steps. This looks very easy when I just sprayed in the air, but I need to exhale all my air, get that mist right down in my lungs and capturing it. And then with children we have masks, so they can actually use these devices.
Okay.
Oh, nice.
All right. Well, good. And it looks like you brought some show and tell items as well. Selena, what do you have?
Definitely. Well, like Cindy was saying, the clinical assessment is so important, but the environmental assessment is just as important because, you know, families are at the greatest environmental risk in their own homes, which is where they have the most control. And so that's what we're trying to get across, is that, you know, we want to control the asthma as best as possible, and a great place to start is in the home. And I'm going to refer back to the Keep It document here. And what my tools do are evaluate all of these things, well, most of them. And the biggest thing is we look at well maintained. We just want to make sure that the grading outside the downspouts, you know, the water's not flowing into the home, which could potentially cause mold. And another thing we look at is the temperature differentials, kind of see where people are losing energy. And that's the great thing about the City of Fort Collins. We have so many great programs, and they offer energy audits for about $60. And so we use this to kind of show where people are losing energy in their homes, and it shows the temperature differentials. And we see it in a lot of the doorways, a lot of, you know, there's just bad ventilation going on.
I have a question about mold. You know, we live in a high desert climate.
Yeah.
So is mold a real big issue here?
You know, we live in a very forgiving climate, which is great. So we're not like out east where they see mold all over the place. But there are a lot of asthma people who are super sensitive to mold. And so we don't see it a whole lot, but when we do see it, we know there's a problem. And we mainly see it in bathrooms. You know, bathrooms are the smallest areas in the home, and that's where all the moisture is at, right?
And they often don't have windows. I would assume that would play a role.
Definitely, or the fans aren't working. And so we look at the fans, and what we do is our Charmin test. So we grab a little piece of toilet paper, and we turn the fan on and stick it up there. And if it sticks, it's working. If it doesn't stick, well, we know we have a problem.
So everyone can go do the Charmin test now.
Yeah, and so that's just kind of one of the things that we look at to make sure that there's not a high amount of moisture or humidity in the home. And that's what we use this guy for. So this is a thermohydrometer. And so it's got quite a name there. And so it tells us the humidity readings in the home. And if there's too much humidity in the home, well, we know that they may have some mold problems or some moisture problems in the home. So another thing dealing with moisture, because mold is a big deal, and we find it in crawl space, we find a lot of moisture and mold in weird places. But we use our moisture meter. And I'll show you. I'll turn it on, and see, my hands are super, super moist. And so that's why that went off.
It will not go off if I hold that instrument.
No, are your hands dry?
Very.
Yeah, so that goes off. And whenever that goes off, we know there's, too much water in a wall, or too much moisture, more like, or there's a leak somewhere. And so we're very aware of that because mold can make us really sick and impact our indoor air quality a lot.
So I can imagine when your volunteers go into a home, they're equipped and they look something like Ghostbusters with all of these gadgets and these electronic meters going off. And
yeah, so they're extremely useful in identifying any problems that might be going on in the home that we can't necessarily see or feel or smell. And so they do help out a lot. And just the other things on our table, thanks to the Poudre Fire Authority, carbon monoxide and smoke is another big indoor air quality aspect. It really impacts our indoor air quality and what we're breathing in. So when we go out, we provide carbon monoxide alarms to every household. And then we also provide a smoke alarm and make sure that they have them. I'm so surprised how many homes we go into and they don't have CO alarms. It's just not very, well thought about, or they don't know a whole lot about it.
So the Healthy Sustainable Homes program, I know, has helped at least one family not be poisoned by carbon monoxide. So let's take a look.
The majority of Americans spend 90% of their time indoors, and the indoor air quality is typically 70 to 90% worse than outdoor air. 50% of all illnesses are either caused by or aggravated by poor indoor air quality. And residents are at the greatest environmental risk where they have the most control, their own homes.
Right before Emerson was born, we had a Healthy Homes assessment done, and as part of that we were given free carbon monoxide detectors. We plugged those in, and then a couple months after she was born, they started going off at about 10 o'clock at night. And we weren't sure what to do. We were having headaches, we weren't feeling well, but we knew we had to get out of the house. So we got out of the house and we went to a hotel that night, and it turned out that it probably saved our lives because there was carbon monoxide coming from our water heater. The meter was reading about 300 parts per million, which can be deadly. And I hate to think what would happen if we hadn't gotten out of the house.
Almost 500 people are killed every single year across the nation, and thousands more are sickened and have to go to the hospital from carbon monoxide poisoning. We recommend residents install at least one carbon monoxide alarm near sleeping areas in their home if they have any fuel-burning appliances. Additionally, we recommend testing that unit once a month to make sure it operates properly, and replace the batteries at least once a year, normally during daylight savings time. This little effort could protect your family.
So it turns out that the information we got from the Healthy Home Assessment probably saved the lives of our family.
The Healthy Sustainable Homes program is a free volunteer-driven program for residents of the city of Fort Collins to learn low-cost and no-cost solutions to make their homes healthier.
Take the time to make your family's home as healthy as you can by doing a Healthy Homes assessment.
Your family's worth it.
That's an incredible example of how this program really does help people. And outside of the prevention that's available through the Healthy Sustainable Homes program and all of these medical gadgets that we have on the table, let's talk about some treatment, Cindy. Because these gadgets help people prevent and manage respiratory
very
issues.
much our
Let's
goal.
talk about some treatment.
Okay, thanks. Yes, well, I mentioned programs to learn about your asthma and management programs. I should mention for the populace with COPD, we have a really, really lovely program called Pulmonary Rehab. And that's run here in Fort Collins at Poudre Valley Hospital and also in Loveland at MCR. And it's remarkable how much the quality of life improves if people who have chronic lung disease take that program too.
What does that program involve?
That program is very much also about the education of what's actually happened in your lungs, what the medicines do, but the other key to that piece is that they start training your body. It's very hard and it creeps up slowly, shortness of breath and lung issues. So you become more sedentary, and then your body's not moving. You lose confidence because you're short of breath. So they step by step walk you literally, but strength training, and they have exercise physiologists.
I was going to say, so it's an exercise.
They're fabulous.
program.
They have a nice gym, and they work you up to have your body back in shape so that you can live every day as well as possible.
All right, what are some other treatments?
Well, one I don't want to forget to mention because it's actually very new. Most people with asthma, with good medicine management and seeing physicians and watching their breathing, doing the right things, breathe well every day. But there is about 10%, maybe a little bit more of the asthma population that no matter what doctors do, no matter what medicines we try, no matter how many triggers they take out of their life, they are daily impacted by their asthma. We call that severe asthma. And there's a new treatment called bronchial thermoplasty. Very simple. I'm not going to go into it in detail, but I will tell you that it's had great outcomes.
What's it like?
You do go under an outpatient surgical procedure, so you're awake, sedated, or sedated, and then they take a bronchoscope with a small heating tool, and my understanding is the heat is as much as a warm cup of coffee. So it's not like they're really damaging. What they're doing is they're trying to settle down those spastic muscles in the airways, and it's working.
How often does somebody have to have that?
Boy, you're asking the
done?
great questions. Well, I will say that the treatment involves a number of those procedures. It's not like we can go into someone with severe asthma and do that
Just
and they
once.
can make it. Well, we have to do it in portions for just a toleration of working with sensitive lungs.
So is that something somebody would have to have done routinely
A few times
every
it's-
year?
No, I'm sorry. The outcomes are great so far.
Okay.
And that's why I'm excited
good.
about it. And I mean, I know they've seen it to 5 years. Oh, this is working. We have something new to offer these folks with severe asthma. But as far as the whole process, you go under 3 of these procedures.
Okay.
To work it up. So there's a few months involved with the whole
Nice.
therapy. But that's great. And
That
then
is.
they also, another new treatment, although it's not as much involved with it is prevention actually. We have a new Navigator Super G ability with this bronchoscopy. And it can determine.
You lost me. Super G, bronchoscopy.
Okay,
What
well,
did
I'm
you
sorry.
say?
What I want they have a new identification ability for people for early lung cancer, and we haven't had that.
Okay.
They've been developing this. They can watch spots on a CAT scan that maybe might be suspicious. We now have the technology to tune into that. And both of these bigger, high-tech procedures go with pulmonary specialists.
Okay.
So that's the group you would contact for more information.
Nice. Well, Cindy, I know that you brought something really exciting
boy,
to the
yes.
studio today, and you are going to show us what healthy lungs look like
Yes.
and what unhealthy lungs look like. Well, Cindy, this is something. What do you have?
This is a breathing lung exhibit.
All right.
It's actually a pig's lung, which is very similar to the size of a human lung and very structurally the same also. So it's a very good demonstration, especially for children. I use it at health fairs, in the classroom. And what I really want to show people is this is without rib cages. This is without our body, without a heart. But we have a nice bellows.
Yes,
If you
and I
wanna
get to pump it up.
Yeah, if you want to pump that
This
up.
is a healthy lung. I just
This
wanna,
is a healthy, like a pink. You can
Here
tell
we
by the
go.
pink, and you're going to see by the way the air can flow into this lung. It's a nice spongy organ, and that's lovely. You're doing a great job. And there's the right side. This is the trachea. You've got the left side of the lung, and if we split the lung open, we'll see the actual airways. But this is the outside of the lung. And so in our breathing, we also have ribs. The ribs aren't here, but the ribs will help with the exhalation. And the diaphragm in the bottom of the lungs is a very strong muscle. And that's our actual physical bellows instead of pushing the air in. What I like to demonstrate, you can stop
All right.
and just see how you can feel it. You don't have to feel it.
I'm not going to feel it.
But you can see how pliant, how compliant that lung was and the way it was able to blow up. Well, if we expose this poor little pig to 20 plus years of cigarette smoking and damage the lung, and this is my strong message of please don't smoke.
Oh, my.
This is if we were to do an autopsy on that little pig.
So
This is
I
a
have to ask,
damaged.
how did the pig's
Oh,
lung get...
yes, what a good question.
How did it get to be this way? Did you really make a pig smoke, or
No.
what did you do?
This is chemically, it's a
feel
company
better.
actually chemically
All right.
makes the pigs after they're
All
not
right.
alive.
I feel better.
Okay, I'm glad, Kim. So go ahead and show the audience the difference, though. You can see it's having a very hard time expanding. If you were here in the audience, but you can kind of see this white nodule. It's a tumor, so we know smoking encourages cancer. And this black tarry is the deposit of the smoke. And then the lungs actually break down. This is a very diseased lung, and you can see that. And it's my message in prevention.
If anyone needs a message,
Please don't smoke. It's not worth putting a cigarette ever in your mouth, ever, because the pleasure you get out isn't worth this pain.
all right.
Any other questions?
No. Do you have any questions, Selena?
Oh, that's really interesting. All I have to say to that is we really don't want people's lungs to look like that. And
No.
with the indoor air quality being, at 5 times worse than outdoor air quality, and we spend 90% of our time indoors, I mean, this is really what we don't want to see happen. So
Right.
we need to get all air quality under control, right?
Right.
Yeah.
All right. Well, as we wrap up today's show, Cindy, thank you for bringing
Welcome.
all of the toys and the lungs, because this is very impactful to me. Not that I was going to take up smoking, but now the deal is sealed for sure.
Yeah.
There's an opportunity for people who want to get involved in your program to volunteer to go into homes
Right.
and to test for indoor air quality. And we'll show the
Yeah, definitely. Training starts April 8th, and we focus on all the keep it areas of the home, and they're trained by professionals, 15 different professionals, and with Fort Collins reporting 1 in 4 family members having a respiratory issue, I say let's get out there and reduce that number.
There's a chance to volunteer with this, and there's a lot of resources available through the University of Colorado Health to help people manage their respiratory issues as well as prevent them.
That's right.
All right. Well, I can't thank you both
thank
enough
you.
for being here today and for showing us everything that you showed us. It's been really fantastic. And I want to thank the University of Colorado Health for sponsoring our show, and thank you to our viewers who make it all happen. Thank you, and we'll see you next time.